It's most of the time it's pretty much painless, other than the needle stick. So you have that initial stick, which of course will hurt a little bit. But if you remember, if you ever had a blood draw or an IV or anything, once that needle goes in, it's usually not hurting. It's in position, and so at that point, it's just kind of okay. You feel it there, but it's not like you're feeling a constant stick. It's already kind of passed into the vein. So at that point, just injecting the foam usually doesn't hurt unless those veins are literally like right either in the skin or right under the skin. If that's the case, you might feel a little burning because there's a little bit of alcohol substance mixed in with that foam. But other than that, most patients don't feel much of anything. I'll always ask them how they're feeling during the procedure as I'm going, and most of them say, "Oh, fine." They're just kind of hanging out there while I'm doing the procedure. Yeah. So right after we're done, and when I say we, it's my vascular tech is always there with me. We wrap the leg and place a little bit of a kind of a foam donut, if you will. But it's straightened out. It applies a little pressure right on that place where the vein was. So my procedure was to get that vein to close, but I want to keep pressure right on that spot so it will stay closed. So after the effect kind of wears off and your body recovers a little bit, the vein might want to reopen. So this foam pressure right on that area, and then wrapped with an ACE bandage, applies some pressure right immediately to the leg and to that area on the leg. And after that wrap, they can get up and walk out. They're done. And that's another thing that's really nice. It's nice for the patient that you come in, you get your procedure, you see the effects almost immediately, and within minutes you're up, you got your shoes back on, you're walking out of the clinic. It's really nice to have that quick effect. It's great for us. We love to see those types of results, and someone feeling better and looking down and seeing that somebody may have had a abnormal huge vein for years, literally sometimes 20 or 30 years, and it's shrunken. It's like, where'd it go? It really shrinks that quickly. And then of course they're wrapped, and we encourage them to walk, be active. We don't want them to just go somewhere and kind of sit and feel like, oh, I just had a procedure, I can't do anything. No, we want them to be active, because part of that activity, the muscle action in the legs, keeps blood flowing to other veins, and reduces the risk of blood clot forming, which is one of the potential complications of any type of vein procedure, including this type of foam sclerotherapy. So, not much, different. The only restrictions are not lifting heavy weight in the kind of the immediate several days after the procedure. Because if you're lifting heavy weight, and my restrictions is no more than 25 pounds, just as a generic amount. But the issue with that is you can generate quite a lot of pressure inside your body when you're lifting heavy weight, and it's just for short periods of time, but that pressure can tend to reopen a vein like that. So that's the reason for that precaution.